All right, so let's continue on looking at some of the gross anatomical detail of the heart, and then we'll come back and discuss some of that regulation or the anatomy associated with that regulation of that flow of blood through the heart. Remember that pattern of atria contracting, ventricles contracting and relaxing, so on and so forth. So let's begin by looking at this image once again. Like I said, this is the mother lode of information for us here. Let's review and add some more to this. We start here with the atria, right atrium, left atrium, right ventricle, left ventricle, remember that entire space. Papillary muscles with the chordae tendineae attached to the atrioventricular valves, right, the AV valves. And remember, this right AV is also referred to as the tricuspid, the left AV is the bicuspid, and also referred to as the mitral valve, right, kind of categorizing it based on shape. The mitral shape, here are the semilunar valves, and we'll refer to them as the aortic semilunar valve and the pulmonary semilunar valve. And while we're here, let's recap the vessels coming in out of the heart. Coming in, the superior and inferior vena cava, correct? Coming from the systemic circuit. Coming in from the pulmonary circuit, we have on either side 2 on the left and 2 on the right. These are the pulmonary veins, remember, coming back towards the heart. And so these 2 back here would actually pass behind the heart and enter right back here somewhere. That's where you can't see them. These two right here come in right there, right? That's what we're looking at. There should be 2 more coming in from the right side, from here, okay? Now, pulmonary veins coming in, vena cava coming in, leaving, we have the pulmonary trunk branching into the left and the right pulmonary arteries, and then the aorta, as we pass through the aorta, forming this arch, which is going to descend. And the trick is, if we put the heart in standard anatomical position, this, remember we said we kind of rotate it to the left and skew the apex forward a little bit, and so this is going to actually rotate a little bit backwards, and so this will run straight posterior, straight back, rather than to the left like you see in most illustrations, because in standard anatomical position the heart is rotated to the left. All right, so this runs straight down behind the heart. Then some kind of new structures for us. Over here we find the interventricular septum. Separating the two the ventricles is the interventricular septum, the wall of myocardium, separating the 2 ventricles. And we'll be able to recognize this actually superficially. In fact, looking from the outside of the heart, we'll be able to identify where the atria are, where the ventricles are, and even where landmarks to show us where that interventricular septum sits. Down here is the apex once again, don't forget that, while we're at it, right? And then, these are the papillary muscles. All throughout the ventricles, we also find a series of folds. These are called the trabeculae carneae, and these increase the volume of the muscle mass of the chamber, without sacrificing the actual volume of the space, the chamber. So this basically allows for a stronger contraction, more force to be generated. And then within the right ventricle, within the right atrium, we also find more of these little folds, and these are referred to as pectinate muscles. Those pectinate muscles have the same role. They increase the force of the contraction. There are 2 more structures here that are actually kind of interesting. We can see them here, and then I'll show you on the superficial view as well. Actually, you can only see one, but it's right here. This is called the fossa ovalis. The fossa ovalis was the foramen ovalis. All right, your Latin's going to come into play here. Foramen versus fossa, what's the difference? Foramen is actually a hole. Fossa is just the flattened surface, the depression, if you will, versus a hole, right? So the idea here is, there, it's fun to draw. The foramen ovalis, the fossa ovalis, used to be a hole, which closed up. Why would there be a hole? Well, this was actually a bridge running behind to the other atrium. In fact, there's another fossa ovalis in the left atrium, which you can see it in this illustration. There are fossae ovalis on either side. Why? Because there used to be a canal connecting the 2. These foramen ovalis were connected, and this was a bypass, because think about it. During fetal development, while you yourself are in utero, you don't breathe. Mom's doing all the breathing for you. Mom is responsible for breathing, right? Your respiratory system is not bringing in oxygen and removing carbon dioxide. Mom's taking care of that for you. So there is a little bit of blood supply, right? We have developing tissue in the lungs and so on and so forth, but we're not actually breathing. And so we have a bypass which bypasses the pulmonary circuit. We have several of those actually, because here's the trick. Your respiratory system is one of the last things to develop. The most significant problem is for premature born babies. For babies born prematurely, are respiratory issues because your respiratory systems aren't fully developed. They're not fully online until after parturition, after birth, or just prior to. And so this foramen ovalis closes just prior to parturition, just before birth. And in premature birth, it actually can still be open, and there's all kinds of complications associated with that. This is one of those bypasses for the pulmonary circuit. In fact, there's another one here that's actually really cool. Let me show you. There is a little ligament sitting in between the pulmonary trunk and the arch of the aorta. This is called the ligamentum arteriosum. It's anatomically interesting, developmentally interesting, and also makes for a very cool Harry Potter spell, right? Ligamentum arteriosum. Sounds like something from Harry Potter. But this ligament used to be something called the ductus arteriosum. You guys seeing the pattern here? And that was a bypass from the blood going to the pulmonary circuit rather than going to the lungs. Some of the blood would go right back into the systemic circuit, bypassing, so not as much blood went to the lungs because we weren't using our lungs at the point. This also atrophies, and just like we saw with the ligamentum teres earlier, it becomes a little ligament, which is a remnant of an embryonic blood vessel, right? So it bypassed that fetal respiratory system, or the developing respiratory system. While we're here, looking at the superficial view of the heart, let's take a look at some interesting anatomy here. First and foremost, we can quickly gauge where we are. Inside, where the chambers are, by comparing some of the blood vessels and some of this gross structure here. So here we have this little flap, ear-like flap. In Latin, the term auricle means ear, and so this auricle is the outer flap-like covering for the right atrium. Over here would be the left atrium, so we can quickly tell where we are. This auricle hides within it the right atrium, and over here is the right ventricle. I'm sorry, the left atrium. And over here is the left atrium. That means all this is ventricle, right? And we can find the separation between the two. There's the apex, but running down the center, there's a little sulcus, a little groove. This is called the anterior, because it's in the front, interventricular, because it's in between the two ventricles, sulcus. That's it right here. Anterior interventricular sulcus. We'll talk about the blood vessel there in just a second. Right? The anterior interventricular sulcus sits in between the two ventricles, which means what? Which means all of this space here is your right ventricle, and all this over here is the left ventricle, right? But wait a minute, something's wrong here. I told you guys that the left ventricle is so much bigger. Well, why does it seem small? The right side seems larger, because remember, this is rotated to the left, and that's why this left ventricle is actually hidden, making the right ventricle the most anterior chamber of the heart in standard anatomical position. All right. Now, this gives opportunity to describe some of the blood vessels providing blood supply to the heart. In fact, if you look at the heart, if we look at what's called a corrosion cast of the heart, I'll come back to the illustration in just a second. It's a really cool picture. Corrosion casting is interesting, and we'll look at this when we look at circulatory system. In essence, we take an organ, we inject it with a colored latex, a polymer, which solidifies, which polymerizes inside the blood vessels, and then we dissolve the rest of the organic tissue. So all that's left is the polymer that was inside those blood vessels in this case. We can do that for urinary system, for any kind of plumbing, if you will, in the body. But here in the heart, you can actually see all the blood supply, all the blood vessels running through the heart. There's the aorta coming off. Here are the auricles around the atria, and look at the mass of the heart, right? All that muscle needs blood supply, and the heart cannot get access to luminal blood. Blood passing within the chambers, passing through the chambers of the heart, cannot provide that muscle with nutrients, cannot provide it with oxygen, cannot remove carbon dioxide, and so it's insufficient. So the heart, like any other organ, like any other tissue, needs its own blood supply. Now, there's kind of a trick question I ask all the time, and I'm going to give you the answer right now. But I'd rather you guys know it than be tricked by it. Quite often, people ask, "What is the first blood vessel What are the first blood vessels to emerge off of the aorta as it leaves the heart, as it leaves the left ventricle, right? The pump to the systemic circuit, leaving the aorta. The trick is, as the aorta ascends, then arches over and then descends. So we have the ascending aorta, the arch of the aorta, and then the descending aorta. Off of the arch, this is the obvious answer, the brachiocephalic artery or trunk, and we'll talk about that in a little bit. And then the subclavian and common carotid. We'll describe all this when we talk about circulatory system. This is like main blood supply to your arms and your head. That's a big deal. But the reality is, if you look at the ascending aorta, just behind the pulmonary trunk, there's two little blood vessels that emerge. In fact, you can see them coming off right here. Just as the ascending aorta passes through the aortic semilunar valve, there are two little branches coming off. There's one right here and one right there. This is the left and this is the right coronary artery, right? So left and right coronary arteries branching off the arch of the aorta. Those are the first vessels to branch off of the ascending aorta, not off the arch. All right, these then quickly will branch. On the left side, the left coronary artery will quickly branch into one running down this interventricular sulcus. So this is referred to as the anterior interventricular artery. There it is. All right, this is the anterior interventricular artery running down that anterior interventricular sulcus, and then branching laterally, running around the circumference of the heart. This is called the circumflex artery. The circumflex artery runs along that border between the left atrium and the left ventricle. On the right side, the right coronary artery travels for a spell, doesn't branch right away, and then eventually branches into what's referred to as the marginal artery, running along the margin. And the trick to identifying the marginal artery is that in standard anatomical position, this artery is going to be right along this lateral margin, because if you just rotate this so you have the chambers squared up, this will be off to the side behind the heart. You're not going to see it. But in standard anatomical position,